Hello, and welcome to part 2 of a bite into TMJD's Identification Assessment and Management. In this video, we will be talking about the assessment aspect of TMJD and discussing the subjective and the objective interview. So diving straight into it, in terms of the subjective assessment, we'll be using the acronym WANSNOR, which stands for Where, Onset, Consistency, Severity, Nature, Other Symptoms, and Referral Pattern, Pain. Essentially, so you want to find out what the mechanism / mode of injury was, so asking the patient where their pain is and asking them to point to where it is. So in this case, they'll be pointing around the jaw TMJ area. The onset of the injury, is it acute, has it been a chronic issue, asking them for the consistency of the pain, is it constant, intermittent, what percent of the time, is it one side or both sides or one or the other. Then asking for the severity in terms of asking for a pain rating. So you can use the NPRS scale, so giving 0 to 10 and finding out as a measure. And then asking the nature of the pain is very important as well. Is it sharp shooting pain? Is it dull ache? Is it stiffness? So just clarifying all that stuff. Then you're going to ask for other symptoms such as cold, heat, numbness, weakness, toothache, dizziness, nausea, blurred visions, pins and needles. So if they're experiencing any of that. Then we have the referral pain, so it could be a facet issue that could be bothering them as referring to pain. Along with you want to find out the current past history and general health of the patient as well. For this, you can ask them for diagnostic imaging if it's available, and then you want to find out the irritability of the patient's condition, what aggravates them and what eases them. Alright, so let's dive into the little bit of the symptoms presentation of the TMJD. Essentially, pain can be reported around the TMJ itself and along the jawline and along the muscles, the temple and the jaw, so the masseter and the temporalis, and the upper cervical spine, both anterior region, so the SEM, and posteriorly around the suboccipital region. And then you can also get joint noises like locking or clicking noises, and it can be with opening or chewing or eating or swallowing and yawning, so any jaw movement of sort. So you want to find out if they experience that. Usually if they have any parafunctional oral habits, like they have bruxism, which is grinding of the teeth, clenching of the mouth, if they breathe with their mouth, if they're mouth breathers, if they have chewing habits like biting on nails, biting on pens or pencils, people who sing and play musical instruments as well, they use their mouth, also have usually experience TMJ pain and dysfunction. You're looking for dental signs as well, such as braces and wisdom teeth removals or having wisdom teeth. Then you have your headaches or neck pain, which can be also associated and presented with people with TMJD. So you can also have ear symptoms such as ringing, stuffiness, dizziness, ear infection, loss of hearing acuity as well. And this can be also related to inner ear pathology as well, so you want to be really cautious about this when receiving this information. And it could be a peripheral vestibular dysfunction such as Meniere's disease or carotid artery dysfunction as well. So just be mindful of that. Patients can also present with TMJD with eye symptoms or pain, autonomic system endocrine problems, level of stress or tension may be increased with these patients as well, and cervical spine dysfunction as well, which we'll be discussing later. Now, some aggravating factors with this is that it could be a good place to look at and give to your patients who come through with this is the jaw function questionnaire. And basically, they're going to ask you questions about chewing, drinking, exercising, eating hard and soft foods, smiling, laughing, sexual activities, cleaning teeth or face, yawning, swallowing, and talking. So it gives you a good understanding if they're having trouble with all these stuff or not. Then there's a couple of things that I want to clear up with you. So usually, in terms of the symptom details, so the clicking sound, it could be a crepitus, or it could actually be a click with opening, closing, or turning of the jaw sideways, or bringing of the jaw forward. And they could be locked and restricted movements as well. So you want to ask the patient to clarify, does this occur during closing or opening, or does it, how does it occur after a clicking sensation? and how long does it take to ease, and what eases it, and if there's any restriction, like the restriction, is it periodic or is it continuous, is it always there? So those are some questions that you want to clear up with them. Now in terms of headaches, they could be either one-sided or they could be both-sided depending on if how many if one or both of the TMJ is affected. It's twice as common in females than males, ranging from 19 to 83. I know it's a large range, but it affects everyone because we use this muscle this joint many times a day. And there's no clear pattern on the behavior, but generally it can also refer along the pathway of the trigeminal nerve, so that's something to be mindful of. Now, in terms of red flags, what you want to clear up with the patient is if they have any recent trauma and fractures. And what you can do for fractures is a special screening test. It's called the tongue blade test, which we'll be talking about later. You also want to clear up that if the patient has any past history of cancer, any recent unexplained weight loss, neurologic pain symptoms, such as hearing, vision, speech, and migraine. Any cardiac pathology, as cardiac tissue usually refers to symptoms to the jaw itself, so that's something you want to clear up with the patient as well if they have any cardiac pathology. Any oral infections in the last 6 months, any strange taste in the mouth, because that's also a sign of oral infection. Any history of emotional or psychological stress that could be bothering them. Any medication usage, symptoms of vertebral-basal insufficiency is very important, and upper cervical insufficiency is also a red flag. Central nervous system dysfunction and cranial nerve dysfunction is also a red flag as well. So just clear that up with them if they have any history with that. Following that, what we'll do, that wraps up for the subjective assessment, and we'll dive straight into the objective assessment, where we will be discussing the observation, active and passive range of motion, special tests, reflexes, strength testing, palpation, ligament stress testing, and diagnostic imaging. One thing you want to make sure is like pain in this region isn't specific to the TMJD itself. Like it can also be reported in like primary headaches such as migraines and tension type headaches, and also in secondary headaches such as cervicogenic headaches. So it's good to have a differential diagnosis as well, just to keep in the back of your mind. Now, what I'm going to do is now I'm going to play a video for you. I've already gone ahead and conducted a video explaining all the stuff in the slide for you in terms of observation. So have a look at that and we'll continue. In the observation, what you're trying to do is conduct a general postural analysis. What you want to do is expose the area of interest and then assess the patient from front and side and back. From the front, what you're trying to do is look for any symmetrical imbalances. So if there's any rotation, any deviation of the jaw or the head itself on from midline, from the plumb line running through the center. Okay. And then what we can also see at this point is the mandibular resting position as well. If it's far down, or if it's to one side or the other as well, or if it's too far up too. Okay. What we can also look at is the skin color and the temperature and compare it to one side and the other, or if both sides are affected of the TMJ, you can compare it to another part of the body and see if there's any differences there. What we're going to do now, face the other way to the side. Good. Looking from the side, what you're trying to see is if there's any forward head posture. That's one of the main things associated with TMJ issues, is people protruding their head forward, which causes retrusion of the jaw, because when you poke your head out, you tighten up these muscles down here, which causes the jaw to come back and cause stress at the TMJ itself. So assessing that over here. Again, other things you can look at is if the shoulders are rounded forward as well. Okay, turning the patient back, facing this way. What you can have a look at is ask them to open up their mouth. Good. Once they open up their mouth, you're looking for any issues with general healthy appearance, and so if there's any wearing or tearing from bruxism, which is commonly associated with TMJ as well, which is grinding of the teeth, so you'll see them worn down quite a bit. Are you looking for any crossbite, overbite, any swelling, any cuts, any on the cheek, on the lips itself, as well as you can look at the tongue and see if there's any thrust, indentations at the front, the side from the teeth. So you can also see the resting position as well. And once all that is clear, if they have any dentures or any braces, we can clear that out and you have more information available to you. Close your mouth for me. What you're also trying to see here is if they, you can check their breathing pattern, if they're mouth or nose breather as well. All right. All right. So now we'll look at a little bit into the active and passive range of motion, which I've also will be discussing all this things on the slide in that video. So let's watch that video. All right. So now we're going to be looking at a little bit into the ranges of motion. So before we do so, what I would like you to do is actually open and close your mouth slowly so I can observe your opening and closing motion. What we're trying to see here is from the frontal plane is see if there's any jerky movements of throughout or in the opening and closing phase. Good. We're looking for any deviations in terms of that make a C pattern or a S pattern. The C pattern is associated with dysfunction on one side of the TMJ, whereas the S pattern can be a combination of capsular restriction and muscle dysfunction of the pterygoid muscles, which we discussed earlier. And so in this case, this patient is pretty well. Now, at the same time, while he opens his mouth, you can also feel the TMJ, and you're going to feel for any clicking or any crepitus or any of the issues that they are reporting themselves. Good. Is there any pain when you do that? Okay. Next, what we'll look at is take a measurement of how much they're actually able to open their mouths, so the depression of the jaw. So we can use a ruler to measure this out. So open your mouth as much as you can, and you want to take a quick measurement from the top to the bottom, which is roughly about 5 centimeters. So which is really good in this case, as this patient does not have TMJ, but patient who will have TMJ may have not such a great opening. Okay? So next, what we're going to look at is elevation. Elevation is just coming of the teeth together. So can you clench your teeth together for me? Good. Any pain or discomfort? Good. It's very important that you do ask your patient throughout these ranges of motion if they have any pain or discomfort. Next one is protrusion, which is just bringing of the jaw forward like a bulldog. Can you do that for me? Good. What you're trying to see is see if the patient is able to bring the lower incisors in front of the upper incisors, which in this case he is able to do so. Next one is retrusion. So what I want you to do is bring the jaw back, and what I don't want you to do is tuck the chin in. Okay? Go ahead, do that for me. Very good. Any pain or discomfort? Okay. Now the next one you want to assess is your lateral trusion, which is turning of the jaw to the side or to the other side. Can you do that for me? Good. Good. So what we're trying to see here is visually inspect if the same side canines of the mandible are passing the same side canines of the maxilla, which in this case he is doing so. Good. Next, we'll assess the passive ranges of motion. Next, we'll be assessing the passive range of motion. For this, for the purpose of this video, I'll be only assessing one side, and we will make sure you are wearing gloves, as some of this testing is done intraorally as well. Okay, so we're going to start off with protrusion of the jaw. For this, you're going to ask your patient to open your mouth, and you're going to place the 5th digit on the molars on the side that you are assessing. So, down like so, good, on top of the molars, and then just ask the patient to relax. What you're going to do is pull out in an upward motion. At the same time, with the other hand, you're going to feel the TMJ joint for any abnormalities. You can ask the patient for any pain or discomfort. Good. Alright, next one you'll do is protrusion or retrusion, which is the same placement of the hand, and you're going to feel the TMJ joint with the other hand, and push back, and you're assessing for any movements in there. Any pain, discomfort? Oh, good. Alright. Next, what we'll be doing is opening up your jaw. Okay, so I'm going to place my hand over here, same position, and you're going to passively open up and extend the jaw, and with the other hand you're going to feel the TMJ joint of the side that you're pushing down on. Any pain or discomfort? You're looking for any restrictions and clicking movements over there as well. Good. Okay, next one we're going to do is the lateral protrusion. For this, you need to place one hand on the zygomatic arch for firm support, and then the other hand is going to be placed on the mandible, and then you're going to push the mandible hand to see how much lateral protrusion there is. Good. And then you will do the same thing on the other side, and you're assessing for any stiffness or pain or discomfort that the patient reports. Is everything okay? Good. And that is your passive ranges of motion. Alright, so now that we've done the active and passive range of motion, we'll be looking at the special tests. And with the special test, essentially it was the one we were talking about earlier, which is called the tongue blade test. And essentially it is a test that is used to inform the clinician if any X-ray is required to screen for fractures. And basically how it's done is you get a tongue depressor and you insert it in between the molars, the top and bottom molars on one side, and then the clinician tries to break it while the patient clenches onto the tongue depressor. Now, if the clinician is unable to break it, or it slips out of the mouth of the patient, then further investigation for fracture of the mandible or the maxilla is indicated. And basically it has a 95% sensitivity, so it's fairly well, and 65% specificity. Alright, next thing in terms of the reflexes and strength testing. For the reflexes, more traditional neurological screening in terms of cranial nerve testing can be helpful in overall differential diagnosis process of patients with face, head, neck symptoms. But because TMJD is generally limited to articulodiscal and muscular components, those test procedures we will not be reviewing in this video. And in terms of strength, patients can be screened for symptoms of provocation with resisted movements, which are just to one side, this side, pushing down into the chin, and pushing out into the chin as well. The traditional manual testing scale has little objective applicability with respect to TMJD. So we'll be moving on from that. In terms of palpation, I have already made up a little video for you, which I'll put up now, and we will have a look at. Bear with me. Alright, for palpation, what we will be doing is palpating extraorally, intraorally, and the TMJ joint itself. Extraorally, we'll start off with is the temporalis muscle, which is the muscle right along the top, if you remember back from part 1, where we discussed the anatomy and biomechanics. So, you can either use one fingertip, or reinforced one fingertip touch, or 3 fingers to have a more general sense, whichever you prefer. And you're feeling for any trigger points, any pain, and basically any abnormalities within the muscle. And you want to make sure that you cover all of the muscle itself. Any pain or discomfort? Okay. Good. Next muscle is your masseter muscle, which is basically in front of your TMJ, and it goes below the zygomatic arch. Okay, so right over here, and it goes to the angle of your mandible, right along to there. So from here to here. And you're going to feel the whole belly of the muscle from the insertion to the origin. Any pain or discomfort? No. Okay. And of course you'll be feeling bilaterally like anything else. But for the purpose of this video, we're focusing on one side. Then we're going to be feeling the digastric muscle. There's 2 points where you can feel it. One is at right underneath the angle of the mandible. So while the patient swallows, so swallow for me. Good. And you'll feel that muscle right along there. Any pain or discomfort when I do that? And you're feeling for any trigger points in there as well. Next part of the digastric muscle was the one that comes from the front, the anterior bellies. So you're going to feel over here. Good. And because they act to open up the mouth, so you're going to ask the patient to open up their mouth. Open up for me. Good. And you'll feel them pop up. Good. And just relax. And then feel the whole muscle bone. Any pain or discomfort? And again, you're feeling for any trigger points in there as well. Good. Now that you felt all the muscles surrounding it, let's see the TMJ joint itself. So you can feel for the lateral capsule. So right over the joint. Any pain? Good. You look for any stiffness, any pain, discomfort. Then the next one what you can do is the posterior capsule of the TMJ joint. What you can do is by using your small finger and going in through the ear. Any pain or discomfort? No. Okay, good. And then the last one is for the TMJ joint is the posterior lateral capsule, which is you can feel by asking the patient to open up their mouth and feeling right at the joint itself. Good. Any pain or discomfort? No. Okay. So now that we've covered the TMJ joint and the extraoral, you would have to change of your gloves, and we will go into the intraoral cavity, the mouth, to feel the medial and lateral pterygoid muscles, which are very important. Good. For the medial pterygoid muscle, which is the one that creates a sling with the masseter muscle, you will feel by using a small finger. Ask the patient to open their mouth. Just relax. You're going to place your finger right along the bottom row on the outside cheek side, and you're going to feel all the way at the back. That will be your medial pterygoid muscle. Any pain or discomfort? No. Okay. Now your lateral pterygoid muscles, which are the ones which I said were very important earlier in video number 1, you can feel same way, but you'll be using your pinky to go in, and this time you're sticking to the top row and going all the way back, and in a sweeping motion you can feel the lateral pterygoid muscle. You can also ask the patient to open their mouth, slide your pinky in, and then close your mouth, and then the muscle that pushes up and squeezes your finger is your lateral pterygoid muscle. Alright, and that is your palpation. Alright, so now that we've done the palpation, we will now talk about the ligament stress testing. So essentially, we have the collateral ligaments, which run along the sides of the joint, and medial. Basically, they're tested with the medial and lateral translation and compression to the side. Then you have your sphenomandibular and the stylomandibular ligaments, which are the ones that are at the back, if you remember back to part 1 video. And they're tested by protrusion on full or late closing, bringing of the jaw forward. Then you have your malleomandibular ligament, which is tested in anterior translation in compression. And the temporomandibular ligament, remember it has 2 bands, the oblique band, the one that runs at an angle, which limits the rotation of the condyle, and the horizontal band, which limits the translation, anterior translation. So how do you test these? Essentially, the oblique band one, you posterior inferior movement of the condyle at 25 millimeters of opening, and then the horizontal band essentially is a posterior translation of the condyle in compression. Alright, so from all this, what will happen is you will make a diagnosis, and the subgrouping of TMJ disorders essentially into 5 main groups. So you have your myogenic, your arthrogenic, and your disc displacement with reduction, and your disc displacement without reduction, and your cervical spine involvement. So essentially the myogenic, first of all, is maybe present with or without limited mouth opening, and often associated with bruxism, which is the grinding of the teeth, and it's often confirmed with palpation of the muscles, and it produces pain referral and response to soft tissue treatment techniques. The arthrogenic is essentially associated with joint pathology, so arthropathy or hypermobility, and presence of audible or palpable crepitus at the TMJ itself, and assessment of the joint compression, passive, active movements, dysfunction, confirm the response to joint manual therapy treatments. The third one is disc displacement with reduction. Essentially can be associated with joint noises but not locking itself because of the term reduction, and can be painful or pain-free. And essentially is a disc displacement without reduction is associated with the altered positioning of the disc in its relationship to the mandibular condyle, and in the closing mouth position that relocates with a click. So essentially the disc slides in front of the condyle over the articular eminence, and then what happens is as you continue to open the mouth, the mandibular condyle goes on top of the disc, which creates a click, and then when you close your mouth at about 35 millimeters, it slides back over the disc behind the disc again, which causes a click. So that is disc displacement without reduction. And then disc displacement that was displacement with reduction, and without reduction essentially is maybe present with or without limited mouth opening, in which acute phase is very often very painful, and they can't open their mouth or close their mouth because simply the disc is in the way and it's not allowing it to jump over. And then the last one, the fifth one, is basically cervical spine involvement, and often it's concurrent with TMJD dysfunction found on accessory movement examination, cervical palpation, and confirmed with response to manual therapy. So as we discussed in the palpation video, the observation video, how forward head posture really affects the jaw positioning itself as well. So keep those things in mind. That was your subjective and objective assessment, and I look forward to meeting you in the treatment video. Take care. Bye.